To effectively control and prevent heat stroke at a national level, here are the summarized strategies broken down into key characteristics. 1. Public awareness. Nationwide campaigns to educate on heat stroke prevention and early symptoms. 2. Media outreach, use of television, radio, and social media for public information during heat waves. 3. Heat health alerts. Timely warnings for extreme heat conditions similar to weather alerts. 4. Cooling centers. Establish air-conditioned public spaces for vulnerable populations. 5. Mobile cooling units. Deploy mobile stations for high-risk areas with limited infrastructure. 6. Water distribution. Install free water stations in public places. 7. Public hydration campaigns. Promote staying hydrated through reusable water bottles and media. 8. Green spaces. Increase parks and trees to combat urban heat islands. 9. Reflective and green roofs. Encourage cool roofs or green roofs to reduce building temperatures. 10. Shaded infrastructure. Build shaded bus stops and walkways to minimize sun exposure. 11. Workplace regulations. Mandate heat safety rules for outdoor workers, including breaks and hydration. 12. Temperature limits. Set guidelines for safe working temperatures in heat-sensitive industries. 13. Workplace training. Train employers and workers to recognize and prevent heat stroke. 14. Emergency services. Ensure quick response teams are ready for heat stroke incidents. 15. Public first aid training. Teach citizens to manage heat stroke through first aid programs. 16. Support for vulnerable groups. Create check-in programs for elderly and disabled people. 17. Homeless assistance. Provide shelters and water to the homeless during heat waves. 18. Heat-resilient buildings. Promote the construction of heat-resistant structures with better insulation. 19. Energy access. Ensure reliable power for air conditioning and subsidize cooling equipment for low-income families. 20. National heat health plans. Develop coordinated plans for heat wave response, risk communication, and emergency protocols. 21. Policy integration. Embed heat prevention in broader public health and environmental policies. 22. Lightweight clothing. Promote the use of appropriate clothing during hot weather. 23. Limit outdoor activity. Advise people to avoid outdoor activities during peak heat hours. 24. Proper hydration. Emphasize the need for adequate fluid intake and the avoidance of alcohol and caffeine. 25. Heat-related data. Collect data on heat-related illnesses to inform policy decisions. 26. Climate research. Invest in research to develop new strategies for climate adaptation. 27. Climate change mitigation. Implement long-term policies addressing climate change and reducing heat waves.